Zoloft is used to treat depression and conditions like obsessive-compulsive disorder, also known as OCD, panic disorder, social phobia, also known as social anxiety disorder, and premenstrual dysphoric disorder, also known as PMDD. Different dosages will be used to treat different conditions. Your doctor will determine the dosage for you. Zoloft belongs to a group of medicines called selective serotonin reuptake inhibitors, also known as SSRIs. Zoloft's scientific name is sertraline. There are many brands out there for sertraline other than Zoloft. They work equally well and may be a cheaper option for you as long as you are not allergic to any excipients, which is the non-essential ingredients of the medication, such as the colors and the fillers. So, how does Zoloft work? Alright, before we understand how Zoloft works, let's understand how your cells produces serotonin. I know, you are asking what is serotonin? Serotonin is a chemical that your nerve cell produces to communicate with the rest of your body. It regulates your mood, appetite, and sleep. So, now let's imagine your cell is a car factory. And serotonin are red cars that the factory produces. When you are depressed, one of the reasons is because maybe there isn't enough red cars in your brain to regulate your body to make you feel happy. To solve this problem, one of the ways is we give the factory more raw materials to make more red cars. The raw material for serotonin is an amino acid called tryptophan. Tryptophan can be found in foods such as whole wheat, oats, brown rice, lentils, beans, potatoes, nuts, and more. Yep, you guessed it right. If you consume more tryptophan-rich food, you create more building blocks for your car factory to produce more red cars. Thus, more red cars can go out and work and make you feel happy. Now, in these factories, there are red car reabsorption machines as well. It's like after I produce my cars, I want them back machine. So, after these car factories spits out their red cars, their machines will reabsorb some of the red cars back. This is where Zoloft comes into play. Zoloft acts as a kink. It goes to these car absorption machines and places itself there to jam the whole system, leaving more red cars available outside working to make you happy. 40% of patients does not respond to the treatment of SSRI. So, if after a period of time Zoloft still isn't working for you, chances are you do have enough red cars in your body. The problem of your depression may not be because you have insufficient serotonin. It might be coming from somewhere else. Your doctor will then work it out where the problem lies and try and tackle it from a different perspective. I've seen from time to time patients refusing to take antidepressants, thinking that they will be addicted to the medication and leaving the condition untreated. Well, there's no evidence that Zoloft is addictive, so that shouldn't be a concern. One thing I must mention in this video is serotonin toxicity, also known as serotonin syndrome. This is when there are way too many red cars in your body. This condition is life-threatening. Symptoms of toxicity are like headaches, shivering, high temperature, muscle rigidity, diarrhea, and many more. I've put a list of more detailed serotonin syndrome symptoms down in the description below for your reference. Make sure you and your family know these symptoms, and if this does happen to you, you are sent to the emergency department of the hospital immediately. Common causes of serotonin syndrome are SSRI drug interactions. So make sure all your treating doctors, if you are seeing multiple doctors, know that you are on SSRIs and avoid taking any over-the-counter supplements from the pharmacy or health food shop before checking with your doctor or pharmacist. So, how do you take Zoloft? It doesn't matter if you take it with or without food. Take it at the same time every day with a glass of water. Taking it at the same time every day will help you remember to take it. If you forget to take the medication, you might feel a little uneasy. But do not double up the dose. Wait until the next day and resume at the normal dose. If you overdose, immediately call your doctor or the closest emergency department of the hospital. Normally, Zoloft is taken in the day, but if it makes you drowsy, take it at night before you go to bed. Remember, this medication takes 2 to 4 weeks, sometimes even 4 to 6 weeks to feel the results. Even when you are well, it will take several months or longer for you to experience the full effect. Do not get discouraged thinking that the medication does not work. Keep taking it as long as the doctor tells you to. Now, before the medication actually works, you will experience some minor side effects, such as minor nausea, sweating of the hands. These are all normal. Keep pushing through. Don't get discouraged. However, if you are experiencing any major side effects, such as symptoms getting worse, experiencing distressing thoughts like harming yourself or committing suicide, you need to go to your doctor immediately. Or if the clinic is not open, go to the emergency department of your nearest hospital. These symptoms are more likely to happen if you are under 24 and during the first few months of the treatment. Tell your close ones about this so they will help keep an eye on you. Okay, we've covered today what Zoloft is, how it works, and how to take it. Please give this video a thumbs up if you find value in this video and subscribe to my channel to keep it alive so I can keep making these free videos for everyone who needs it. Comment down below about your experience with Zoloft, or if you have any questions for me, or what other medication videos you want me to make next. All the best with everything. It's singer-songwriter pharmacist Sun-Ki here. Live life to the fullest. I shall see you around. Bye bye.